And as of April 28th, when we kind of crunched the numbers yesterday, nearly 150 million people being diagnosed with COVID-19, over 1.2 million in Canada alone. The Secure IBD Registry, an international database of individuals with IBD who've tested positive for COVID-19. On March 19th, there were just 21 people in that database. Today, nearly 6,000 people have been reported throughout the world. And we can clearly see 3 waves of the pandemic in Canada. And this graph shows the daily number of cases of COVID diagnosed over the past year in Canada. The first wave of the pandemic between kind of March and May of last year, daily cases were exceeding roughly about 1,500 diagnoses a day. And you could see in the summertime, they kind of waned down dramatically and then picked up again in the fall. And at the peak of the second wave, which was in January, there were about 8,000 cases a day being diagnosed across Canada. And the valley of the second wave, where things had kind of leveled off, we were still diagnosing around 3,000 new cases a day of COVID-19. And that is higher than the peak that we saw of daily cases during the first wave back in the spring of 2020. And as you can clearly see from this graph, Canada is currently in our third wave, which is the worst to date to nearly 10,000 cases a day across the country. Driving this number down will depend on what we do collectively and how quickly Canadians become vaccinated for COVID-19. So I just wanted to address this question. Why does the virus spread throughout society, and how do we stop transmission? In other words, why is SARS-CoV-2, the coronavirus that causes COVID-19, spreading so quickly throughout Canada? How infectious a virus is, or how easy it is to catch, is defined by the virus's reproductive number. The reproductive number means the average number of people infected by one sick person in the absence of interventions to control the virus when the whole population is susceptible to infection. Now, when that reproductive number is below 1, then one infected person on average will infect less than one other person, and the virus declines throughout the population. When the reproductive number is equal to 1, then one infected person on average will infect one other person, and the daily number of cases in the population remains stable over time. However, when that reproductive number exceeds 1, infections increase through the population. Now, features of SARS-CoV-2 that make the virus highly infectious include its mode of transmission, which you understand is both droplet and airborne, its incubation period, which is roughly about 5 days prior to symptom onset, and the fact that many people who are sick with COVID-19 are either asymptomatic or just mildly infected. They don't realize that they're sick when they're transmitting it. And probably one of the most important factors is just the novelty of SARS-CoV-2, which makes the entire population susceptible to it. Now, without any interventions to control the spread of SARS-CoV-2, its reproductive number is 2 to 2.5, double that of seasonal influenza. This means that left unchecked, one infected person on average infects between 2 and 3 other people. Then those individuals infect 2 to 3 people, and eventually you'll witness the exponential growth as seen in this animation. In the absence of natural immunity to a virus or the availability of vaccines, the only way to drive that reproductive number of the virus down is to institute public health measures such as hygiene, physical distancing, masks, personal protective equipment, and staying home. The results of these interventions is to drive the reproductive number below 1 by preventing contact between individuals, one person who's infected and one person who is susceptible to infection. As displayed by this figure, avoiding contacts means that fewer people are infected and infect others around them. Now, comparing our third wave to our first wave, 2 new factors are influencing the reproductive number of SARS-CoV-2. First are variants of concerns, mutations of SARS-CoV-2 that increases the transmissibility of the virus. These variants make the virus easier to acquire and in turn raise that reproductive number of the virus. Counterbalancing the pressure of new cases is the escalating vaccination of Canadians from those on the front lines to those who are most vulnerable to the general population, as well as ongoing public health measures that continue to protect the public from infections. Now, this tug of war between variants and vaccines, as well as the actions of the public to prevent transmission, will define the height of subsequent waves of COVID-19 in Canada and ultimately the waning of this pandemic around the world.